Hi, my name is Hayley Suchland and I am doing my presentation over lateral epicondylitis, also known as tennis elbow. For the bony anatomy of the elbow, the joints included are the humeral ulnar, humeral radial, and proximal radial ulnar. The bones associated with these joints are the humerus, ulna, and radius. The soft tissue anatomy of the elbow includes several ligaments and tendons. This includes the annular ligament, ulnar collateral ligament, and radial collateral ligament. The tendons include the common extensor tendon, common flexor tendon, and biceps tendon. Lateral epicondylitis pathologies include contractile overloads of the extensor tendon, hyaline degeneration of the extensor tendon, as well as inflammation and tearing of the tendon. The mechanisms of injury of tennis elbow includes overuse, bad body mechanics, and repetitive stress. The signs and symptoms of lateral epicondylitis includes a point tender lateral epicondyle, stiffness and soreness, pain with gripping, wrist extension, ulnar deviation, and pronation, with a decreased range of motion. The special tests used to find tennis elbow include the Cosen's test, the Maudslay's test, and the Mills test. The first picture shows the Cosen's, the second shows the Maudslay's test, and the last shows the Mills. People who are predisposed to tennis elbow are ones who have improper biomechanics, weak muscles, wrong fitting equipment, repeated extension activities, as well as overhead activities. Lateral epicondylitis is recognized through pain and weakness with wrist extension, a point tender lateral epicondyle, reduced grip strength, and decreased ranges of motion. The differential diagnoses of tennis elbow include radial tunnel syndrome, which is a syndrome resulting from the compression of the posterior interosseous nerve at the proximal forearm. This is also called posterior interosseous nerve syndrome. Osteoarthritis, which is wearing down of the flexible tissue at the ends of bones. Fractures, cervical radiculopathy, which is the disease of a cervical nerve root, and fibromyalgia, which is widespread muscle pain and tenderness. To manage and treat tennis elbow, police, NSAIDs, physical therapy, ultrasound, bracing, steroid injections, and possible surgery is used. Severe cases of lateral epicondylitis are referred to a physician and possibly an orthopedic surgeon. This injury isn't immobilized but uses bracing for management. This bracing includes compression bracing, as seen in the first picture, support braces, seen in the second picture, and compression sleeves, seen in the third picture. To prevent tennis elbow, strengthening key muscles, increasing wrist and elbow flexibility, avoiding repetitive motions, using proper equipment, and using correct biomechanics are extremely important. There is only one mulligan technique that is used for tennis elbow, which is shown in the video below. The patient lies supine with their elbow extended and forearm pronated. A lateral glide is applied to the radius and ulna by the clinician while the patient repeatedly extends the wrist. This is my PICOT analysis for lateral epicondylitis. This includes a 45-year-old man who received corticosteroid injections for his tennis elbow. The pain significantly decreased along with an increase of range of motion in just 6 weeks.